Hello, welcome to the program today. It's such a pleasure to try to fix this a little bit. Thank you all for joining me. My name is Edith, and I am a registered nurse. And I'm an educator, okay, and I'm going to be talking about high blood pressure and hypertension today. I hope you really love this topic because over time, I have put in so much into studying why people, have high blood pressure, why do people have hypertension? So, what is high blood pressure? I'm sure a lot of you must have, had a family member, a friend, or you probably have hypertension. And, every time you go to the doctor's office, all they do is maybe check your blood pressure or give you a new medication or, send you home and, you're scared you're probably going to, God forbid, die or something, right? So, what is high blood pressure and how does this affect your health? So high blood pressure is the force the blood has to exert on the blood on the arteries, right? So your arteries are blood vessels that carry blood from, the heart and down all over the body, right? So if your blood has to exert a lot of pressure on those arteries in order to go through, then the pressure is going to be high. So blood pressure is the force that is, exerted on the arteries. Now, this is measured in millimeters of mercury, mmHg. So, in case you see 135 over 65 mmHg, that's just your blood pressure. That's just the unit for measurement. Now, we also measure blood pressure using a cuff, and you have the automatic cuffs or the digital ones, and then you also have the manuals, like what we use in the hospitals. Some hospitals, I like to use the manual sometimes when I get some ridiculous blood pressure with the digital one. So because the manuals sometimes they work better and they're more accurate, because think about it, this digital things, sometimes the batteries are bad, sometimes the cord is bad. It could be so many things you can imagine. Now, a normal blood pressure is supposed to be less than or equal to 120 over 80. So if your blood pressure is 125 over 82 or 130 over 79 or 130 over 81, you might be pre-hypertensive. Okay, and that's something I want you to look into. So it means that every time your heart contracts, your blood your blood pumps at a rate of 120 or less, and then it relaxes or it rests at a rate of 80. So if your blood pressure is 120 over 80, it means that your blood pumps at a rate of 120 millimeters of mercury, and then it relaxes at a rate of 80 millimeters of mercury. And that's something I want you to really understand. Now, what is hypertension and what is high blood pressure? High blood pressure is the reading, right? Oh, your blood pressure is high. It means your numbers are high. It means that you might need to work on it. But then hypertension is a diagnosis, right? So hypertension is a diagnosis that is given to someone who has multiple blood pressure readings that are greater than 130 over 80. So if your blood pressure is greater than 130 over 80, like 3 or 4 times on different visits to the doctor's office, then yes, you might be hypertensive. So it's something that I want you to know about, because if you're home and you're not monitoring your blood pressure and you're having all this symptoms and all of those stuff, then you might be causing your vessels a lot of damage. So this indicates that if your blood pressure is above 130 over 80, it could indicate that something is going wrong. Yes, maybe your boyfriend broke your heart, or God forbid, or something happened, or your employer hasn't paid you and it's time for you to pay your rent. Yeah, or the kids are acting funny and all of that stuff. Yeah, they could make your blood pressure go high, right? So it doesn't mean that you necessarily have hypertension, because what happens, your employer puts the money in your account and boom, your blood pressure goes down, right? So yes, your blood pressure reading one time does not necessarily mean that you're hypertensive. In the doctor's office, it's always advised that you come back about 2 weeks later. If you have one high reading, you want to come back about 2 weeks later, and then they recheck, and then you come back again, and then they recheck. Except in cases where we have hypertensive urgencies like 180 over 120, then yes, that you might be hypertensive, because for the heart to stretch that much, it means that something has been going on. All right. So you can have an occasional episode of elevated blood pressure or high blood pressure. It doesn't mean that you're hypertensive. All right. So what do the numbers mean? I talked about 120 over 80 being the normal blood pressure. So what does 120 mean? 120 is the systolic blood pressure. Yes, I know that might be a little difficult for some of us to kind of memorize or just register right now, but it took me a while before I figured that out. So the systolic blood pressure is the force at which the heart ejects blood, right? The pumping force of the heart is the systolic. And then the diastolic, which is the bottom number, is the resting or relaxing force. So at what rate does the heart relax? The heart's supposed to relax gently, right? But then if it relaxes at a very forceful rate, then yes, the person might be hypertensive. So like I said, normal blood pressure should be equal to or less than 120 over 80. Now, which number is more important, the top one or the bottom one? Well, the both numbers are very important, but again, if the top number is consistently high, it means that the heart is having a hard time pushing blood throughout the body, right? So we give a lot of attention to the top number, which is the systolic blood pressure. And then, but sometimes in people that are greater than 50 or 60 years old, we notice that they have something called isolated systolic blood pressure. It means that the systolic blood pressure, which is the top number, is constantly high, and that sometimes is as a result of the stiffening of the arteries, due to age. Okay, so if you're 65 and your blood pressure is kind of high after a few readings, yes, you should see your doctor, but I wouldn't really want to stress so much about that, okay? Now, if your blood pressure is constantly high, this could cause a lot of damages, and that's why I am bringing this to you today. If your blood pressure is constantly high, think about it. If you have a rubber band and you keep stretching it, you stretch it, it feels nice, right? You keep stretching it, it feels great, and then you stretch it until a point where it passes its elastic limit. What's going to happen? That rubber band is going to break. So the same thing applies to your blood vessels, to your arteries. The more they stretch, the more the force of the blood on the arteries, the more they stretch, they keep stretching, and then someday, hopefully not, the arteries can break, and then what's going to happen? The individual can have a hemorrhagic stroke, the individual can have a stroke, or just anything. So you don't want your blood vessels to keep increasing at that force. So that's why it's very important to keep your blood pressure under control. And we're going to come back to medication use. Now, if your blood pressure reaches 130 over 80, it's said to be that you have hypertension, and the risk for cardiovascular events begin to increase exponentially. Like I said, the individual could be at risk for hemorrhagic strokes and all of that. So even if you don't have symptoms, don't be like my mom who waits until she has symptoms to start taking her blood pressure medicine. Your blood pressure medicine is not supposed to be an emergency medication. It is supposed to be a management. It's supposed to prevent those arteries from expanding so much. And then there are different types of blood pressure medications, like I had said a few weeks ago. There are medications that work directly on the arteries. There are medications that work on the kidneys. There are medications that increase peripheral resistance. There are medications, there are so many medications. There are some that help you excrete water. Some help you retain water. Some help you excrete potassium. Some help you increase potassium. So there are different things. The mechanism of action of the blood pressure medicines vary. And so that's why, first of all, you don't want to share nobody's medication. If your doctor prescribes a medication, please take that medication for yourself. Do not try to give your grandma some of your blood pressure medicine. Do not try to share your daughter's blood pressure medicine. Do not try to share somebody else's medicine, because what happens, that individual could have a kidney problem, or you could have a kidney problem, and the medication that you are sharing is not good for your kidneys. So what happens? It damages your kidneys. So it's very important, before you start taking any blood pressure medicine, you have to see your doctor. They need to check your heart, they need to check your kidneys, they need to check a whole lot of things before they prescribe your medicine. All right, so we're going to go really fast. So different stages of high blood pressure. We have elevated, which is from 120 to 129. I kind of call it pre-hypertension, right? 120 to 129 over 80. Then the stage 1 is from 130 to 139 over 80 to 89. So if you're between 130 to 139 and then systolic, and then 80 to 89 diastolic, which means 130 to 139 the top number, and then 80 to 89 the bottom number, then you might have stage 1 hypertension. Now, stage 2 is anything equal to or greater than 140/90, okay? So if your blood pressure is equal to or greater than 140/90, you are at a stage 2 hypertension. And yes, at this point, the doctor might need to put you on a combination of blood pressure medicines. Yes, you might have to be on, water pill and a blood pressure medicine, or 2 blood pressure medicines and a water pill, or even more than 2 blood pressure medicines. Okay. Now, we have emergency situations, which are pretty much hypertensive crisis, and these are stages when there is need for urgent emergency care. So a patient, or you know someone who has a blood pressure of 180/120, yeah, that's an emergency, because what happens that the arteries of that individuals can rupture and the person can have a stroke. So that's not something we want to play with. If you know anybody whose blood pressure goes into the 180s, 190s, 200s, that is not safe. That is not safe. That is not something you want to play with. You want to go to the emergency room. You want to see a doctor right away, because what happens, that's a hypertensive crisis, and it could really cause a lot of damage. So if you have access to 911 or any emergency care, please do not hesitate to run over that. Now, one thing I want us to know is there are people who have this really high blood pressure and don't have any symptoms. Yeah, some people they're fine. The blood pressure is 200/150 and they're just okay, right? That is not normal. If your blood pressure is running in the 180s, 190s, of 130, 140, you need to see the doctor. Now, in worst case scenarios, when you start having headaches, when you start having dizziness, you feel nauseous, you feel like you're going to pass out, you start sweating, you become short of breath, you start having numbness or tingling of your extremities, then yes, it is time for you to seek the nearest emergency room. A lot of people have died because they took their blood pressure readings for a joke. They didn't go to the doctor's office. They sat at home. I mean, you feel it. You feel like you have a headache. You know your blood pressure is getting high and you just choose to be at home. Guess what? You're going to run into a crisis and there's not going to be any emergency help. So as soon as you have that feeling that something is not right, please go see a doctor. And if you can, as much as you can, do not wait until your readings are that ridiculously high before you seek medical attention. All right, so what are some risk factors? What are some things that can expose or, predispose an individual to hypertension? I have a friend of mine who is watching me right now who had high blood pressure from the age of 18. Yes, there are people who have blood pressures that young. You don't have to be 50 or 45 to have a high blood pressure. So some of the risk factors that are modifiable, we have 2 different types of risk factors. The ones you can change, which are the modifiable, and the ones you cannot change, which are the modifiable. I'm sorry, let me take that back. The ones you can change, which are the modifiable, and the ones you cannot change, which are the non-modifiables. So the modifiables range from, low sodium diets. If you put a lot of salt in your food, you probably need to cut down on it or even just take it off completely. Now, if you're smoking, if you have high cholesterol, you might need to exercise. If you live a sedentary life and all you do is sit in front of the TV and eat bags of chips and potatoes and drink soda, then you need to watch those. Now, the non-modifiable risk factors are those factors that you cannot change, such as genetics. So if your parents had high blood pressure, or your grandparents had high blood pressure, your brothers or sisters had high blood pressure, you might be at risk for high blood pressure. And that's when you need to start being very cautious of the things that you do, exercise, lose some weight, and just be very conscious of your health. Now, some other non-modifiable risk factors include genetics, family history, let's say, socioeconomic status, you can change that. Okay, but age, race, you're black, you're white, Hispanic, especially the blacks, African Americans, black folks have a higher tendency for, high blood pressure. And then the older you get, the more the arteries stiffen, and then the more the risk you are for getting high blood pressure. And of course, like I said, genetics. If it runs in your family, don't wait for anybody to tell you to check your blood pressure regularly. Okay. Now, if you drink alcohol, those are modifiable risk factors. You need to stop drinking alcohol. If you're not active, if you don't exercise like me, please try to start exercising. All right. So, what is primary hypertension and essential hypertension and secondary hypertension? So primary hypertension are those hypertensions that are just there, nothing caused them, such as, when you have, like, if you're genetically predisposed to hypertension, then yes, you might have primary hypertension. But then secondary hypertension are the ones that are caused by another disease. So for instance, let's say your arteries begin to clog because of high cholesterol, then yes, you start having high blood pressure. That is secondary hypertension. Okay, now we have another thing called gestational hypertension, and I'm not going to try to go into details, but that is hypertension that happens after 20 weeks of pregnancy. So if a woman is pregnant, and then she starts having high blood pressure at 20 weeks and above, then yes, it is gestational hypertension. And usually after she puts to bed, she becomes better. But then if you know anyone who is pregnant and having hypertension, they need to see their doctor. They need to be managed because it could lead to something called eclampsia. And one of the symptoms or whatever is seizures. So you don't want to be pregnant and have a seizure, right? That's not going to be safe for the woman. It's not going to be safe for the baby. So if you're pregnant and your blood pressure begins to go high, then yes, you need to see a doctor. And if you have high blood pressure and then you choose to get pregnant, please see your doctor, because there are medications that are not safe for the baby. There are medications that are not safe during pregnancy. The doctor needs to change your medications to the ones that your system can absorb during pregnancy. All right. So the next I'm going to talk about is how does high blood pressure, damage your vessels. I already mentioned this. The heart is something you don't want to get bigger, right? I know people say the bigger the better, right? But not in the heart. You don't want a larger heart. Your heart is supposed to maintain the size of which it came with, right? You don't want your heart getting any bigger, and that's something called hypertrophy. So what happens when the heart begins to work so hard and begins to, when the heart does a lot of, work, and just like I said, in the rubber band case, it stretches so much, it could cause the heart muscles to become weak and to damage, and then it predisposes the individual to cardiac arrest and all of that stuff. You don't want that. So a lot of stretching by the blood vessels, by the heart muscles, is not something you want, and these are complications of hypertension. Again, hypertension affects the kidneys. It affects the kidneys. It destroys the little the vessels in the kidneys. It destroys the vessels in the eyes, the tiny blood vessels in the eyes. It destroys the vessels in the brain. It does a lot of damage. So if you can, as much as you can, you want to try to make sure that you protect yourself and keep your blood pressure as low as possible every single time. Now, I already talked about complications, aneurysms, which are like the vessels breaking or bursting and having blood go into where it's not supposed to be. Chronic kidney disease could be another complication of high blood pressure. Eye damage, heart attack, heart failure, stroke, peripheral artery diseases, and vascular dementia could be complications of high blood pressure. So what is the plan? How do we prevent high blood pressure? And if you already have high blood pressure, how can we manage it? So first of all, check your blood pressure at home. Make sure you have a cuff, you have a blood pressure cuff at your home. Make sure you check your blood pressure reading every day. You can check in the morning when you wake up and at night before you go to bed. And keep a daily log. And I'm going to say this, if you need a log, if you need a blood pressure log, I will be more than glad to provide you with one. So you need to keep a log of your blood pressure so that anytime you go to your doctor's office for a visit, you need to go with the blood pressure reading, because the doctor needs to see how your blood pressure, the fluctuations in your blood pressure over time, and that will enable them, make the necessary changes in your medication, or just, leave it as it is, or even, well, maybe not stop it completely, but of course that would help them manage your blood pressure properly. Now, I said if you need a copy of a blood pressure log, please contact me, send me a message here or inbox or whatever, and I will be glad to give you one. Now, you should start working towards lifestyle modification. If you don't exercise and your blood pressure is going higher and higher every day, please try to exercise. Now, if you also stress out so much, you panic about everything. I know the COVID, like this period, when this time of the year and everybody's running around and panicky and scared and anxious. Yes, but again, think about it. You're only causing more damage to your blood vessels by being anxious and worrying about things that you cannot necessarily change. All right, I talked about physical activities. Try to do at least 30 minutes exercise for 5 days a week. That will really help you. Weight reduction, if you're overweight, please try to start, making attempts to lose weight. Now, also, salt intake can affect your blood pressure tremendously. Now, think about it. Salt holds onto water, right? So if you're taking a lot of salt, what happens? Your body is holding onto a lot of water. And think about it, if you go to swim in the pool versus swimming in an ocean, which is going to be easier? Swimming in a pool, right? Yeah. So if the more the water, the harder it is for the hearts to pump through. Okay, the harder it is for the circulation to be effective. So try to keep your salt intake to as minimum as you can. And then for your medications, I already said it, please try to adhere to your medicines. If your doctor gives you medication, if you're having any side effects to those medicines, please try to talk to your doctor. Don't just stop. There are medications you do not stop abruptly. There are blood pressure medicines you do not want to stop abruptly, because you're going to have rebound hypertension. So if you're having any allergic reactions to your medicine, try to have a conversation with your doctor. And like I said, don't share medications. It is not appropriate, because the person you're sharing their medicine might have a different, the medicine might be working on a different organ, or it might be working on a target, a different a system completely than yours. So like I said, if you have kidney disease, if you have renal stenosis, like the neurons of your kidneys are tightened up, there are blood pressure medicines you shouldn't take. So if you go taking somebody's medicine and you're not really supposed to take that medicine, then you're going to have a problem. So please discuss with your doctors before you take any blood pressure medicine. Now, finally, I'm going to talk about the dietary approaches to stopping hypertension, which is called a DASH diet. This basically emphasizes on food that are aimed at lowering sodium, and then foods that are rich in potassium, magnesium, and calcium. And then these nutrients can help us lower blood pressure. Now, this means that you have to take a lot of fruits, a lot of vegetables, low salt, whole grains, and poultry, and nuts and seeds. So if we do this, I'm sure that, pretty much we should be able to keep our blood pressure under control. And thank you all so very much for joining me today. Thank you to everyone who has who is watching me live today. I'm gonna be posting this video on my YouTube channel, Edith Declan. So if you couldn't start from the beginning, it's on my Facebook page, and it's gonna be on my YouTube page as well. I am really trying so hard to make this more interactive as much as possible, like I do with my learning platform. But for some reason, I'm recording with my phone right now. I had a hard time using my desktop because I was trying to share my screen, so y'all can actually read what I have in front of me. But that hasn't worked. I'm still working towards that, and I hope that as time goes on, I will perfect even better. And thank you so much. Thank you to my doctor friend, Dr. Iwuji. He's watching. He's always watching, because at the end of the show, he's going to call me and say, Edith, you did this and you didn't do that and you did a wonderful job, and that makes me feel wonderful. So thank you all so very much. I really appreciate every one of you, and until next week, I want you to take care of yourself and do not allow yourself to be unnecessarily bothered about anything. Okay, have a blessed new week. Bye bye.